Good evening and welcome to the national webinar on supporting entry into training for September 2023 for Dental Foundation training. Next slide, please. I would like to introduce you to the presenters this evening. Firstly, myself. My name is Peter Briggs. I'm the Postgraduate Dental Dean for London, Kent, Surrey and Sussex, but also Lead Dean for Dental Foundation training. We have Jessica Tollerfield from the National Recruitment Office with us this evening, and Flo Miller, who is a current foundation dentist in Surrey, and Shirlene Hallang, who is a current DCT1 in oral medicine in Bristol, joining me this evening to try and give everybody the opportunities and understanding from their perspective of this process. This hopefully is a two-way process, so we are suggesting and encouraging questions during the live event. We would like you to put your questions into the Q&A function of Teams. And because we are limited for time, we're planning the webinar for between 7 and 8:15. Can we suggest that you tick that you like the most popular questions so we can try and address the most popular questions for you this evening? Finally, there will be a recording of this webinar and it will be placed on YouTube, and there'll be a link to it that will be made available to the dental schools, councils, etc., so it can get to all applicants of 2023 Dental Foundation training. Next slide, please. So Dental Foundation training, the presentation tonight from us all is hopefully relevant to Dental Foundation training, recruitment and post allocation for 23-24. That's September 2023 start. It applies for those applying via the Dental Foundation Training National Recruitment Office for Dental Foundation posts within England, Northern Ireland and Wales. There is a separate process for the application to vocational training in Scotland. Next slide, please. Our hope is that this national presentation will provide reassurance to you on DFT recruitment for 2023 entry. The presentation will outline details of the 2023-24 recruitment for England, Northern Ireland and Wales. We're not able at this point to confirm all the dates of the process for you, and we would be grateful if you could bear with us with that. This presentation will be made available to CopDend and the Dental Schools Council for signposting for their functions. Dental Foundation training is a 12-month employment and training, generally within the NHS general or personal dental services. Foundation dentists are employed by the lead employer and are hosted at training sites in England, and that starts in England from September 2022 and commenced in Wales in 2021. There is no lead employment planned in Northern Ireland for 23 recruitment. There are a number of two-year schemes which combine Dental Foundation training and DCT1s that will be available within the recruitment. Satisfactory completion of foundation training, i.e. at the end of training, is the gateway to entry to the NHS performers list in England and Wales and health boards in Scotland, Northern Ireland as an independent practitioner. The recruitment process to Dental Foundation training is a competitive assessment for an employment position, i.e. a job. So therefore it is an interview for employment and mustn't be confused with an examination such as the examinations you've had at school and in dental schools. Next slide. Satisfactory completion of Dental Foundation training will be required to demonstrate satisfactory completion in order to be awarded a certificate of satisfactory completion. You'll be expected to complete both a minimum of 12 months full-time training and demonstration satisfactory progress to achieve the satisfactory completion certificate. Your progress of competence will be formally reviewed by a panel after 5 and between 10 and 11 months of training. This will be done by reviewing reports from your education supervisors, the training program director, together with evidence from your assessments and your e-portfolio information. You'll be required to have demonstrated a broad range of competencies as set up in the Dental Foundation training curriculum, and your training may need to be extended beyond a year if the panel decides that this is necessary. Please note that the delivery of the competencies required may be impacted by the COVID pandemic, and it's important we still say that in 2022, bearing in mind what we have experienced in 2020 and 21. And the timelines for recruitment may be subject for change because of that. All of our hope is that is not the case, but I think it's important this evening that we mention that again. Assessment of satisfactory completion is not an examination. It is an in absentia review of supporting evidence during your training, and this evidence is assessed by an appropriate FRCP panel. You have the right to review and appeal an FRCP panel recommendation if you think the decision is incorrect. The quality management of Dental Foundation training currently aligns to the 2016 Dental Blue Guide and relevant supplements across England, Northern Ireland and Wales. The Dental Blue Guide is currently being updated and refreshed for use in September 2022. So that is the guide that 2023 will be aligning to. So this evening, the following areas will be covered within this short presentation. Firstly, next slide, please. The number of posts and applications for current Dental Foundation training. The examples are the current 2022 entry. So the number of applicants for DFT was 1,172. The number assessed was 1,128. The number of placements offered and accepted in 2022, offers released on the 15th of June. So today was the day that Jess informed me that the offers is released today to the applicants in the current process. The number of Dental Foundation placements currently available in England and Northern Ireland is 896. Next slide, please. Recruitment process to support 2023 entry posts. The aim of the process is to rank eligible applicants, i.e. yourselves, at interview and allocate to 12-month Dental Foundation training posts, or longitudinal, which are 2-year, or some are described as joint Dental Foundation core training, again 24 months posts. And for Dental Foundation training, the allocation is to schemes. So the National Recruitment Office allocates to schemes, and the schemes are what the applicants will be preferencing across England, Northern Ireland and Wales. The Dental Foundation Training National Recruitment Office has been required by the MDRS to adapt the way we select foundation dentists as a result of the COVID pandemic, and you'll all have experienced COVID pandemic pressures in your schools during your training period. Ranking will be based on the assessments. These will include a situational judgment test score and may include an extra element for 2023 recruitment, such as a virtual interview, e.g. a communication station, which will be confirmed at the later stage for this recruitment. The medical and dental recruitment selection, that's the MDRS dental subgroup, is currently assessing the results of an external equality impact assessment on the previous Dental Foundation training recruitments. This and the views from relevant stakeholders will feed into the future decisions in terms of an additional element in the foundation recruitment for 2023. There will be no face-to-face interviews as part of the 2023 recruitment process. Ranking scores, weighting is yet to be confirmed. Weighting will be either the SJT, situation judgment test, accounting for 75% of the scores, and the additional element, as I've previously said, currently not confirmed, would account for 25%. Or the SJT on its own would account for 100% of the assessment marks for the assessment. Popular schemes and practices are likely to be more competitive, i.e. more applicants per placements of schemes. Process complies with employment law requirements. Next slide. Declaration at the time of application. In terms of disability, applicants are encouraged to declare any disability on the application form to ensure that they're supported throughout this process. A disability cannot, however, be considered retrospectively. The absolute deadline for this, therefore, is Friday, the 9th of September 2022, which is the applicant close date for 2023 Dental Foundation training application, after which point no adjustments will be made. Allowances adjustments will be made in accordance with health education policies, England policies, which can be found on Oriel. Supporting applicants with special circumstances. This applies to applicants with special circumstances who have a requirement to train in a particular location. The eligibility criteria is followed. 1, applicant is the primary carer for someone who is disabled as defined by the Equality Act 2010. 2, applicant has a medical condition or disability for which ongoing follow-up for the condition in the specified location is an absolute requirement. And criteria 3 is parental responsibilities, where the applicant is the parent of a child under the age of 18. So which training posts are included? Dental Foundation training posts are available, as I've already stated, in England, Wales and Northern Ireland and not Scotland, and these commence in September 2023. Please note appointment and declaration of training practices and education supervisors for 2023-24 will not be confirmed until 2023. Therefore, any location information given on websites is very much for guidance only. It is not recommended that you contact or visit any practices before you have been offered a training place. Scotland will recruit separately, as mentioned, to vocational training. What are the areas? Well, this is the map. We've got several areas. You've got the northwestern England, Midlands and Eastern England, southwestern England. You've got the Thames Valley and Wessex in England, London and Kent, Surrey and Sussex in England, the northeast in England, Yorkshire and Humber, and then you have Wales and Northern Ireland. They are the areas and deaneries in which the placements are located. So the key dates for the recruitment, which I think are very, very important, because whether we like it or not, there's always in a year somebody that forgets to apply and press the application button. So if I can be very strong on these, particularly the areas that are bolded. So the applications for the 2023 process will open on Friday, the 7th of August 2022. And the applications will close on Friday, the 9th of September 2022. So that is the window of application. Anything received after those dates will not be accepted as an application. The situation judgment test, which we'll touch on later, the dates for sitting that will be between the 8th of November and the 16th of November 2022. The additional element, if it is included, is likely to take place between November and December 2022. Preferencing of schemes, we haven't got an exact date, but it's likely to be in May 2023. And initial offers, again, the actual date will be released later, likely to be June 23. And the final offers, including upgrade deadlines, likely to be in July 2023. And these dates will be firmed up when we know them. So how do you apply? There's advert, application form, person specification and application guide will all be available on Oriel website from 12 noon on the 12th of August 22 until the 9 o'clock on the 9th of September 2022. So again, those 2 dates are very, very important. Here's the link and the website. All communication from the Dental Foundation National Recruitment Team will be sent via Oriel. There'll be no person-to-person communication. All of it will be via the Oriel digital platform that is used by Health Education for its recruitments. So a couple of questions that will be very relevant for UK dental students. Question 1, if you're not registered with the GDC currently, please explain why you think you will be eligible to gain the full UK GDC registration by the time of appointment, e.g. final year dental student. Answer, if you are a UK dental student hoping to get your BDS in the summer of 2023. If you are not registered with the GDC, please answer no to the question about the GDC registration, then explain when you expect to register in free text. That will appear below. Example, I'm currently a final year dental student and will gain a GDC registration on completing my BDS. Same question is, will you be required to undertake Dental Foundation as the only route to access the NHS Dental Performers List in England and Wales only? I, graduate from the dental school. Your answer should be yes. If you are a UK graduate, this is the only route that you can gain access to the NHS Performers List, as you are expecting to graduate from a UK dental school. Date of qualification, clearly at the time of filling in the application you will have not have got your qualification, so you need to put an approximate time future that you expect you to get your BDS degree, e.g. June 2023. Next slide please. So how will you be assessed? We've touched on that already. What we do know is there will be a situation judgment test, this will be a timed situation judgment test, and they will be held in Pearson VUE centres internationally, and you'll know that peer VUE centres are also used for driving tests, etc., etc. The format is multiple choice answers in exam conditions, and you get 105 minutes to complete the examination. The additional time can be accommodated in the SJT for applicants with certain health conditions, impairments or learning disabilities. Depending on the recommendation, applicants may be approved 25%, 33% or 50% additional time, but it will depend on the recommendation. An additional 5 minutes will be allowed to complete an evaluation form. The SJT in 2023 will be mandatory and will comprise either 100% of the weighting or 75% if another element is used in 2023. The other element may be a virtual interview, remembering that none of the assessments will be face-to-face for 2023. And the other element would likely to include a single station, potentially with an interview focused on communication. Again, there will be no face-to-face element with this. This would be carried out virtually, and any scenarios used for that element would be made available on Oriel digital platform as it was this year prior to the interviews. In 2021, to give you some idea, the virtual interview comprised of 25% of the score and was done virtually. Next slide, please. Arrangements for sitting the SJT. The SJT will take place between Monday the 8th of November and Tuesday the 16th of November 2021. And they will be carried out at the Pearson VUE test centres across the UK, which the NRO work very closely with for this, both in medicine and dentistry. You'll be able to book your centre and time slot online. You'll be emailed to your notification account and sent a message via Oriel when booking becomes available. If you're having trouble finding a time slot at the Pearson VUE test centre close to your dental school, you should contact the London and South East application support portal, who will liaise with the Pearson VUE centre. Please note bookings are made on a first come, first served basis, so please book early to secure a convenient slot. There are provisions for applicants who are shielding to sit the SJT at home. If this is relevant to you, you must apply through the reasonable adjustments process. More information will be provided in the applicant handbook, which will be accessible on Oriel. The support portal link, as found here, is your communication route to the NRO. Next slide, please. What are SJTs? Well, situation judgment tests are a measurement method used to assess judgment in a work-related situation, e.g. present challenging situations likely to be encountered at work. Applicants need to make judgments about possible responses or actions and are scored against predetermined key. The SJTs focus on assessment of professional attributes and behaviours, e.g. integrity, empathy, resilience, team involvement, working under pressure. It is not a test of dental knowledge and skills. Additional example of SJT questions are available on the CopDent website, and the CopDent is committed to refreshing those questions as necessary. An example of a ranking question where the answers are asked to be placed in rank order. A new patient, Louise, asks you to veneer all of her front teeth. She hopes to pursue a career as a model and has been advised by a friend that veneers may help her to do this. On examination, Louise's teeth are perfectly healthy with no previous restorations and just some mild crowding. Her teeth are a Vita shade A3. So what you're asked to do here is rank in order the following actions in response to this situation. So that's an ordered ranking question. Next slide. So the other is a scenario in the question where you're asked to pick out choices, the most appropriate choices. So a 5-year-old girl comes to see you with her mother. The family are new to the practice. The child looks dirty and unkempt. On examination, the child has a very neglected mouth and 4 deciduous teeth that are rotten. Choose 3 most immediate appropriate actions to take this situation. So what you're being asked to do, you've got several choices and you're being asked to choose the most appropriate choices for that scenario. Next question. Slide even. Preferencing of the schemes, details of schemes, and these are schemes of dental foundation training practices, will be published on Oriel. Preferencing is usually to schemes. After offers have been accepted, each health education area and Celtic Deanery will contact you regarding the process for local allocation to the practices if appropriate for 2023. So this means that you will be allocated to a scheme, and then there'll be a local preferencing process that will allow you to preference individual practices within that scheme, but that's not within an NRO unless untoward circumstances make us do that, and we had to do that in 2020, as Jess will remember. I think it was 2021 we did it, but at the moment there is no plans. Ideally, we'll be preferencing to schemes in 2023 and not to local practices. The preferencing process will occur in May 2023, and applicants will be required to complete their preferences via Oriel. The preferences is likely to open in May, and it will close in late May. So it starts in early May and closes in late May, and you revise to positively preference all the areas in which you are willing to train. Each year, there are UK graduates who are appointable that preference themselves out of the recruitment, i.e. they don't get a placement because they haven't been, they've only wanted to preference a small number, a relatively small concentrated number of schemes for preferencing. My suggestion would strongly be to all of you is to preference widely to hopefully secure a place of dental foundation training. Next point, slide please. So after the situation judgment test and whatever other element is involved in the interview, all applicants will be collated and nationally ranked. Offers to a scheme are usually made in June 23, according to ranking and preference. It is important that applicants understand that there may be an impact on this process from COVID pandemic, and there may be. We're hoping not, but there may be. Applicants will be given 48 hours to accept or decline a post. And upgrading will be available for around 1 week after initial offers, which means that should a higher rank preference become available, then you may be offered this. Once the upgrade deadline has passed, no upgrades will occur. Offer of a post will be according to ranking, and the ranking will result from the assessments, and preferences will be subject to BDS or equivalent, full GDS registration, and eligibility for NHS performer list entry by the date of the commencement of the post. Allocation at this stage is to scheme only, as mentioned, although NRO may need to consider sub-preferences to practice as a severe COVID mitigation, as happened in 21. Matching to an individual practice usually occurs in the local HGE and Celtic Deanery offices later in the year, once the trainer recruitment has been completed, because you need trainers to provide the training, and there is recruitment of those ongoing at the same time if allocation to schemes is possible. Each HGE office or Celtic Deanery or the NRO will publish information regarding local allocation to practices in 2023 once the trainers have been appointed where relevant. Provisional allocation to scheme will take place from June 23 to July 23, but is subject to change due to service configuration, trainer availability and impact from COVID on undergraduate training, etc. Next slide, please. So offers and allocation to scheme. UK dental school applicants will be given priority for a DFT place, as they are not able to access the NHS performance list by another route. All applicants will be informed by the end of January 2023 if they are deemed appointable or not appointable for DFT in the coming year. If deemed appointable, please note this does not guarantee a DFT post from what we've been hearing previously. Quality assurance, dental foundation training recruitment is a quality assured process. The SGT process has been subject to a full equality impact assessment. If the virtual interview is included in 2023, it will include lay representation. The National QA panel will review the SJT and other assessment element scores and rankings before offers are made to ensure fairness and consistency. The QA process will include a lay representative appointed by Health Education England, and a review of the Dental Foundation training recruitment place will be carried out at the end of the process, and lessons learned identified and communicated to the MDRS dental subgroup, which includes external stakeholder representation. National Recruitment Office, the NRO as we call them, will seek feedback from all of its applicants. Key information. Oriel is the recruitment system. It's a digital platform being used through which you need to apply to dental foundation training. There's no other route. Simply registering on the system does not mean that you have not made an application. Does not mean that you have made an application to dental foundation training. You have got to press the apply send button to make your formal application. Registering on the system is not enough. Read the Dental Foundation Training Applicant Guide and Oral Application Guide in full, please, and give yourself enough time to apply before the closing date and time. Late applicants will not be accepted. This is the same for all HGE NRO recruitments. So provide all data requested on the application form and declare any fitness to practice issues or disabilities where relevant by the required deadlines. It's important that you do that. Do positively rank all schemes and practice for which you're eligible to maximise your chances of success. Do accept or reject an offer of a scheme practice as soon as you've received it. Updates. Due to some of the uncertainties, the Dental Foundation Training NRO will send regular updates via email to ensure that applicants are aware of timelines and decisions are made on recruitment. Some email providers filter into junk mailboxes, so please check your junk mail regularly and for anything that you may have missed. Applicants will receive emails via Oriel 2 and notifications to email address used to register their Oriel 2 accounts. Reminder of these important, very, very important dates. So the application date for opens for 2023 recruitment is Friday the 12th of August 2022, and it closes on Friday the 9th September 22. That is your timeline for applying for Dental Foundation training. Outside that, Oriel will not pick up an application. The SJT is likely to be sat between the 8th and 16th of November 22. And the potential additional element, whatever that is, we will update you of grades on that later via Oriel, the process we've just mentioned. Preferences of schemes to practices, we can't give you the exact date, but it's likely to be in May 23, and the initial offers are likely to be in June 23. Advert application form, personal specification, application guide will be available on Oriel websites from the 12th of August 2022. It is your responsibility as an applicant to regularly check your emails and the Oriel website within the published timeframes. Next slide. Health Education England, Wales and Northern Ireland do not run or endorse any paid interview preparation courses for the interview assessment. Example questions are given within the DFT applicant guide along with in-depth information on the whole recruitment process. Please read the guide thoroughly before you submit an application. The applicant guide will be published on our website, and link to the guide will be available from the vacancy in Oriel from the 12th of August 2022. If you have further questions once you have read the applicant guide, please refer to them, refer to the National Recruitment Office by submitting a query through the Applicant Support Portal. Please do not send queries about Dental Foundation Training National Recruitment Office to Copdend or to local offices or to local postgraduate deans. It all needs to go through the portal. I'd finally want to say a word about the Education Transition Document. The Education Transition Document was introduced in 2021. It was jointly developed and agreed by the Dental Schools Council, the Committee of Postgraduate Dental Deans Copdend and the GDC. The goal of the Education Transition Document is to support early year learners, dental schools, education supervisors and GDC with the running through from undergraduate training to postgraduate DFT training. Therefore, Year 5 dental students will be asked to complete the Education Transition Document Part A by your dental school. This will involve self-declaring competency outcome judgments before leaving your dental school and entering Dental Foundation training. The dental school completes Part B, so you will complete Part A from their assessments, and a discussion will take place between you and the relevant dental school individual in relationship to the Part A and the Part B of the Education Transition Document. You then will pass this on to your education supervisor when you commence Dental Foundation training, and the education supervisor will be asked to provide feedback on the Education Transition Document at approximately 8 to 10 weeks into your training. Three additional questions have been added to the 2022 Education Transition Document. One on health and well-being, one on individual circumstances, and the other on adjustments relevant for FD employment. We'd be very grateful for all of you to declare as much information as you feel necessary, important in relationship to that communication process. The education supervisors' data will be collected by Copdend and passed to Dental Schools Council, the GDC and individual local HEE and the Celtic Deanery offices of Wales and Northern Ireland. It is hoped that you as foundation dentists at that time point will support this process and allow feedback to be shared by Copdend to the individual dental schools on an individualized basis, to allow your dental schools to understand how the feedback from the ESs relates to their own identified dental students. So that brings to the end my presentation, and I'd like to pass the presentation baton on to Flo Miller, who is a current Dental Foundation trainee in KSS. Flo.
Thanks, Peter. So nice to see you all. My name's Flo and I'm currently just coming to the end of my foundation training year in a practice in Surrey. Next slide, please. So as Peter outlined, your application is slightly different from mine. Mine was the 2021-20 that went a bit wrong because there was a lot of hectic stuff to do with COVID. So thankfully for you, it's a lot more straightforward. So you've got your September deadline, which is quite soon in September. So I'd really recommend making that Oriel account when you can in August and getting prepared, reading all of the information that goes along with the application as well, just to make sure that you filled out everything that you need to. And with your SJT in November as well, there's a short window for that as well. And then your preferencing will be done by scheme, as Peter said. So it's not as many things to rank, but just make sure you get that all done in time as well. And hopefully you should get a job confirmed in about June or July time. Next slide, please. So my tips for your application is get that Oriel account made in August when you can, and don't leave your application until the last minute. There are actually quite a few things you need to include in your application. And there are quite a few pages as well. So make sure you've got everything thoroughly checked before you submit it. And if you can go through it with any of your friends who are also dental students, then that would be beneficial as well, just so you can make sure that you've all written the same things. And if you need any supporting documents, for example, if you need extra time for anything, make sure you've got those ready to go with your submission as well. And like I said, read all the Oriel handbooks that you can find to do with your application, because it simplifies everything. There are so many FAQs in it. You really can't go wrong with your application if you've read all the supporting information. Next slide, please. So with regards to the SJT booking, it will open at a specific time, and it normally tells you beforehand when that booking is going to open, and it will be at a Pearson Test View Centre. But be quick with your booking because it is very competitive. Some places don't do the SJT even though they are a Pearson View Test Centre, so you don't want to be traipsing miles to get to your SJT. So definitely book as soon as you can to get a convenient slot for you, and make sure that the time does work for you, because you can change your interview once you've booked it, but it's easier to get it right first time. Next slide, please. So some of my tips for the SJT is that it's not an assessment of knowledge, as Peter said, it's part of the interview process. If there is any wording on the question you don't understand, there's normally a glossary that's included as well, so you can easily look up any definitions of any terms you haven't heard of before. I'd also recommend reading the question thoroughly first, the whole way through, before you look at the answers, because sometimes you can see something in the answer which sways your thinking, but actually might throw you off from where you should rank your answers. And in each scenario, you should also look at who is involved. Is it the patient, is it the colleagues, or is it yourself? Because that will alter how you need to rank or decide how the answers best work together. And also think about the impact to patients whenever you're ranking any answers. If something's going to cause a loss of confidence in the profession as a result of something that you rank, or if a patient is at risk of harm if you do or don't do something, then obviously those answers will be more important that they're put either high priority or low priority. In terms of the ranking questions, that's the 5 that you have to rank in best to worst order. You need to choose the most and least appropriate answers first, because of the way the marking works, that will guarantee you get at least 16 out of 20. So if you do those first of all, then you're most likely to be able to get the highest marks possible. And then it's just a question of juggling the ones in the middle, but you're guaranteed to get some good marks. For the best of 3 questions, which was the second question that Peter showed the example of, you need to eliminate the answers that repeat each other. So if you've got 2 things doing very similar actions, choose the one that's most effective and get rid of the other one. You need to choose 3 answers that work well together, but that don't repeat each other. And every time you're answering an SJT, you need to do it from this perspective of a safe beginner. If you're ever worried or you don't know what to do in a scenario, then you should usually escalate it, and that would normally be to your educational supervisor. Don't try and be a superhero. Think about what a safe beginner would do. And as Peter also mentioned, book any courses that you want to go on with caution, because none are endorsed by HEE. There are some practice questions online that you can access via Copdend to show you the type of question that's available, but anything else, you might end up spending a lot of money on something that might not help you. Slide, please. So in terms of preferencing your posts, you need to think about what you want to get from your foundation training. If you've qualified far away from home and you want to go back to your family, or some people might want a change, or you might want to move to the seaside or to a city. So think about what it is that you want to get out of the next year after you finish uni. And as Peter said before, it's really important that you rank all of the places, because the last thing you want to do is go through this whole process and then actually not get a job because you haven't put all the jobs down. When we did it and we had to rank all of the jobs individually, I think I ranked about 950 jobs because I didn't want to not get a job. It's just not worth it after you put so much effort in, especially going through 5 years of uni to get here. And if you end up with a job that's not your first preference, that's fine, but tick for upgrades if you then want to get somewhere higher up your list, because upgrades do happen and sometimes jobs can shift around. So you might end up somewhere that you're happier with that was actually a later addition. And if you're wondering about where to go, then it might be worth going on some young dentist forums and asking if anyone is in a particular scheme that you're interested in applying to, and hearing about their perspective of how they found the scheme. Certain schemes have certain things. Some go on some trips. There used to be one that went abroad. I'm not sure if they're still doing that since COVID, but some schemes do really interesting outreach programs as well. So if that's something you're particularly interested in, then it's definitely worth finding out which schemes can offer that for you. Next slide, please. So as Peter mentioned, the educational transition document was something that was introduced for my year. So it requires you to have quite a large reflective log within it, and you reflect on different capabilities, and that gives your educational supervisor a chance to really understand how you feel about certain procedures and where you feel you might have a lot of confidence and not so much. And they also have a procedure completion and confidence list as well. So you have to tick if you've ever done it in a patient or in a simulation, or you've never done it. And then you also give your confidence as well. So that's a really clear way for your educational supervisor to see how it is that you feel about certain procedures. And I spoke to mine today asking him how he felt it helped him, and he said it's really useful to get a really clear picture of how confident you feel about certain things, but also just the basics of whether you have or haven't done something before, because it means they can tailor that initial induction period to make sure that they spend the time they need to with you about whether you need to be observed doing something, or whether you need to start observing your educational supervisor first before you then start doing something. And then the second part of it isn't to do with you, but it needs to be signed off by your university. And that's where they rank your capability outcome judgments. So there are different sections, and they'll say whether you meet the criteria or you exceed the criteria. So it gives quite a balanced view of not just how you feel about a certain procedure, but also how your university feels that you are about a certain procedure as well. And then this is something you can go through your educational supervisor with during your induction period, and it's uploaded onto your portfolio so you can access it anytime and discuss it with anyone you need to. Next slide, please. So in terms of making the most of foundation training, it's a year, and to be honest, it goes by so quickly. You've definitely got to embrace the challenge, because that's how you'll get the most out of it. Talk to your ES early on and find out how the practice runs. The more you can understand about how your practice works and when the lab comes and when things do and don't get delivered, the quicker you'll find your feet. And make friends with the nurses as well, because they will definitely help you so much. And be open-minded. If you get sent somewhere that wasn't particularly your first choice, it's all about what you make of it. And you might find there are lots of other foundation dentists that also didn't choose to be there, and then you can all group together and create your own group of foundation dentists there. And like I said, some different schemes have outreach projects or trips that you can go on as well. So definitely look into whether that's something you're interested in. But I would say overall, it can be quite challenging, but it's definitely worth it. You will find that you improve your skills so much in such a short space of time. Next slide, please. So in terms of my DF experience, the induction period in London, Kent, Surrey and Sussex is about 2 weeks, where you do a lot of phantom head and you don't spend much time in practice. And then after that, you go in and you talk to your educational supervisor, and you can get a start of how things run. And you don't treat many patients initially, and that gives you a chance to do some more practice of some things you haven't done for a while, such as accessing for a molar endo, which you probably haven't done since maybe April this year. Stepping into a new team is always good fun. You will be the newbie for a bit, but most practices this won't be their first time, so they're used to welcoming a new DF to their practice. You will develop your skills really quickly, but definitely take the time to do this. If you ever have any downtime or at lunchtime you want to practice on extracted teeth, I really would recommend it. You will have a load of study days that you have to attend throughout the year, and those are always with really interesting different external speakers, and they'll always be on a particular topic, but you'll find so much information about how to do things, not just the standard way, the fixed way at uni, but then how to add extra skill into that. So layering anterior composites, for instance, and looking at staining and how you can use different materials to really improve the quality of your composites. And then presentation wise, you have to do some presentations to your scheme throughout the year, and also during tutorials with your educational supervisor, and that just helps to build your confidence when you're talking to other people. And finally, I just want to wish you all good luck with your final year of dental school, and I hope that you all do really, really well. Thank you.
Thanks very much. Shireen,
Hello.
how are you? Great.
Sorry about that.
Well, no, don't you worry. So we'll pass you straight over for your presentation. Thank you very much.
Okay, hello everyone. My name is Charlene and I'm currently a DCT1 in oral medicine at Bristol. So I'm going to tell you a bit about academic dental foundation training. I was the first person to go through this post last year, and I will hopefully be able to answer any questions later as well. Just to very quickly give you an overview of my academic training pathway so far, I gained a BSc in biomedical science prior to my dental degree, and I then went on to do academic dental foundation training in the Southwest, and this was linked to the University of Bristol. And now I'm currently on a DCT1 run through, and I'm based in oral medicine, and I will be starting my NIHR academic clinical fellowship post in September. Next slide, please. So you've all heard about dental foundation training from Flo, so I will not cover that aspect. Academic DFD is a new type of post which has only been around for 3 recruitment cycles. This post is for new graduate dentists who are interested in an academic dental training career pathway. During this post, you would have the opportunity to experience research, which will strengthen your academic CV and help towards a potential application for an NIHR academic clinical fellowship post. Next slide, please. So what makes an academic DFD different from DFD? This is just to show what a typical week would look like for FDs. During DFD, you tend to have 4 days in practice and then 1 study day, whereas with academic DFD, you would spend 3 days in practice, 1 day as a study day, and have 1 day as an academic research day. And you would be expected to demonstrate the same competencies in 3 days compared to the 4 days that the rest of your colleagues will have. Next slide, please. The process for the application is similar to that of dental foundation training. So when searching for the post on Oriel, the academic dental foundation training post is under the recruitment lead of Health Education England Southwest. If you are interested in academic DFD post, you must make 2 applications on Oriel, one being for the academic DFD and the other for the DFD. So this means you have to complete the 2 online applications, take an SJT, and also attend an academic DFD interview through local recruitment in order to be considered. And you would need to go through the process of benchmarking in order to gain an academic DFD post. Next slide, please. This is to give you an idea of the academic DFD posts that were available in 2022. However, this list is subject to change for 2023. There are 1-year academic DFD posts and 2-year posts, which have a run through into DCT1 usually available. Next slide, please. So who should apply for this post? This post is for trainees who have a genuine interest in dental academia, and you would need to be able to show your commitment to this. Past research experience is needed, whether that is during a BSc prior to dentistry, during an intercalated degree or an MSc. Many of you may have also had experience from elective projects or research projects undertaken during your BDS. It also helps if you have research that has resulted in publications or presentations, and if you have achieved any prizes or distinctions. There are also some challenges to an academic DFD, and if you are planning on applying, you would need to be highly organised and efficient, both when working within practice as well as academically. You would have the same requirements needed for the completion of DFT. This means you have to keep up to date with your e-portfolio, your clinical targets, and also attend the study days. And also, research and academia is not a 9-to-5 job, which means that you need to be flexible and understanding that your project tasks may fall outside of the one research day that has been set aside. Next slide, please. And finally, what can you gain from an academic DFT? So these posts will help you learn new research skills and gain knowledge in different research techniques. You will be able to contribute to dental research by well-renowned research centres. You may have the opportunity to present your research at different levels, including local, national, and international. And you will be able to make good academic connections. You can also enhance your CV, which may be beneficial during a later stage, for example, when applying for specialty training. And lastly, majority of academic FDs end up making a very competitive application for an NIHR ACF post, which in turn may lead you to a PhD and further research opportunities. So the academic DFT has given me skills, opportunities, and context that would not have been possible otherwise, and I strongly recommend it to anyone who is interested in something similar. Thank you for listening, and I think that concludes our presentation.
Thank you very much indeed, Shalene, and also Flo. I really appreciate this evening, and we all know how challenging it can be actually doing something like this when we know there's over 500 people, or however it is, watching it. So I think thank you to you both. I think we should move on to questions, and we're getting quite a few questions in, Jess, aren't we?
Shall I read the first one out, Peter? This one's for you.
Yeah,
so is it possible to do a house officer job at a hospital straight after dental school instead of doing 1 year in general practice, or any combined DFT with hospital rotations? This is for students not interested in general practice but wanting to work in a hospital throughout their career.
So in answer to that, in theory, if you don't do dental foundation training as a registrant, and you will be a GDC registrant when you pass your BDS degree, you can go and work in private practice in non-NHS. In terms of the hospital, there are longitudinal programs, there's established programs in the Northeast, and there's established programs in Yorks and Humber that combines. In the Northeast, it's the dental hospital with dental foundation training placements in practice. So in theory, you can start in a hospital pretty much straight away as part of a combined dental foundation DCT program, and similar in Yorks and Humber. There are other pilot 24-month programs, DFT and DCT1 programs, that have grown up over the last few years. One such is in HE Northwest, which is primarily practice-based, so that won't be as relevant for you wanting to be a career in a hospital. And the other is in KSS, where there is the opportunity to start in the secondary care trust, actually, as part of an 8-month rotation. So there are opportunities to do that. In terms of doing a house officer job outside dental foundation or longitudinal training, I don't know how many of those jobs personally are available. In most hospitals would want somebody to start with experience and pre-experience of working and having built up their competency and skills. But it would seem to me that the sort of post that you would be looking for would be the one that combines hospital and CDS stroke general practice as part of the 24-month rotations. And we're delighted that we do have those programs to offer people such as yourself, but I would think it'd be very difficult to find a house officer job that you would just work in for, say, 6 months, 12 months after qualifications without any other periods of experience. Hope that's useful.
Okay, fab. Thanks, Peter. The next question's for me. So the question is, how soon after your offer do you receive your ranking? Will it be within the 48-hour period? So yes, that's correct. So all applicants will receive their rank and offer within this 48-hour period after the first offers are released. There was also a question I noticed about when will ranking release, and is this before preferencing? So I'll answer this at the same time. And we advise that you don't try and guess your chances based on your ranking. Our advice to you is just preference where you want to work. And obviously the more options you preference, the more chances you have to be matched to a post. And then another question for me. So for applicants with special circumstances falling under criteria 3, parental responsibilities, does this also include those pregnant at the time of DFT or who will be due within the DFT timeframe? So unfortunately not. I think special circumstances are not guaranteed for pregnancy, only for people with dependent children. However, I would advise you, if this applies to you, do contact us in the NRO team via the portal if this occurs for you within the process, so that we can provide you with advice. And the applicant handbook will provide all information and requirements relating to special circs, and this will be released at the same time when we publish the vacancy. So next question is for Peter. And this is, what would deem somebody not appointable for dental foundation training?
Thanks for that question. I don't want to go into the details too much, but it has recently been agreed that we used to have a red flag process that potentially could make somebody unappointable for dental foundation training, and therefore they wouldn't be able to preference posts. I can confirm that the red flag process of unappointability is being removed from dental foundation recruitment. So for the 2023 process, there will be no such unappointability in relationship to the process. However, the ranking, individual ranking, will relate to your score at the assessment. So what I'm saying is those with the very, very, very lowest scores will have the very, very lowest ranks, but they will not be in any way labelled as unappointable for dental foundation training.
Thank you, Peter. Okay, next question again is for you, Peter, and which is, what options do we have if we don't get a place in this cycle of DFT?
Okay. Well, if you don't get a offer, or you're ineligible to apply for dental foundation training, let's just say that you're unsuccessful in finals, there will not be an intermediate cohort of dental foundation training in March 2024. I need to be very clear on that. There are no plans at this time point for that. So you would have to wait another calendar year, and you'd have to apply in the normal way to dental foundation training. In the meantime, it'd be important that you didn't de-skill, so hopefully you'd be able to discuss with your dental undergraduate dean or head of school, who could liaise with the local postgraduate dental dean to look at ways in which you could maintain some level of skill and knowledge during that year. But there are, in terms of working in dental foundation training, the option wouldn't re-arise until the following year. You, as a dental registrant, you in theory would be able to work in non-NHS practice during that time period, although you'd be aware of what the issues may be around that, and it's something that you may not feel confident in doing.
Thank you, Peter. So I'll take the next question. So it's, where do you get information about what schemes offer what services, i.e. outreach, travelling, vacation days, salary, etc.? So we publish at the point of preferencing. So this year preferencing took place throughout the month of May. We publish what are called scheme templates, which are Word documents that kind of include information about what each scheme is, where it's located, where the training days are, and include other relevant information. We'll send the links so you can access all of the scheme templates to help you preference the schemes. And then once you've been made an offer, you'll then preference the practices within the schemes locally. So say if you're made an offer to London, the London team will contact you with the practices which are available within their schemes, and then at that point further information will be provided in terms of the actual practices themselves. We've had a couple of questions about the salary, and it was actually included in this question too. The foundation dentist salary is in the public domain.
Yeah, it is in the, what I would add, Jess, in terms of the longitudinal training programs, it's a 24-month period of training. It delivers the competencies of dental foundation training and DCT1, and usually there is a year of payment at dental foundation training and a year at DCT1. I say that as normally that is what happens.
Thank you, Peter. Okay, Peter, the next question is for you. So is it possible to apply a year after graduating with BDS?
Yes, I saw that question, and the answer is of course it is. And there was a concern about whether they would in some way be biased against in doing so, and the answer is no. There is, I think, from memory, Jess, there's a 24-month period.
Yes, it is.
So you can only delay it 1 year, and the reason for that clearly is you've got to maintain your professional competency, knowledge, and skills. But you can do a gap year without any detriment towards you. You would be treated in the recruitment like anyone else. You do the assessment tests, and you'll be given a ranking score, so you'll be dealt with like no differently from anyone else in the application. So the answer is yes, you can do that.
Brilliant, thank you, Peter. And another question for you. What is the difference between FD year and then the DCT and combined 2-year course, which is advised?
So I think there's so basically you can do your dental foundation training satisfactory completion in a year in a standalone post. They're normally a general practice, you know, you're in one practice with either one or joint ESs, and you deliver your DCT1 competencies working either in a secondary care environment, or there are some CDS environments. The advantages of the longitudinal training program: first of all, there's one recruitment process, and that will allow you 2 years of employment. So you're halving the amount of recruitment processes you need to go through if you did standalone posts. You are in one area for a longer period of time at 24 months, and you could argue that you generate more connections and in an area and transferable skills in a post designed to do that. The choice is yours. There is a commitment from Health Education England to develop more longitudinal training programs, and there are a lot more than there were. And it's very much, the downsides are obviously it's a 24-month commitment that you make, and you are in one area. You are not given the opportunity to explore different areas during your your 2-year programs. It's the choice is yours, and I wouldn't say that any one program is any better than the others, and why should I? I think you're achieving the competencies in different ways in different posts, but it's good news for me that with these 24-month programs are there to be offered to people to consider.
Excellent, thank you, Peter. Just bear with me. So the next question is for me. This is: how prevalent and where are the combined 24-month DFT and DCT1 posts located? So this year, so I must caveat this with every year it's subject to change. So this year there have been more longitudinal schemes and 24-month schemes than there was last year. And as Peter alluded to earlier, that it might actually increase even more. But this year, so this is for the 2022, the people who are due to start in September, so you'll be next year. This year we've had 9 schemes, so that's 9 schemes across London, KSS, North East, North West, Yorkshire and Humber and South West, with a total of 54 posts across them. So like I said, there may be more next year, they may be located in different locations, but this year that's where they are. And I'll answer the next question as well, which is: which scheme or area is most competitive and which is least? So I would say this is difficult. It's difficult to answer, obviously, without the data in front of me. I can't tell you, but I've got some years experience, so I can give you a general idea. So usually urban areas such as London, Greater Manchester, Liverpool, etc., they do get the most interest, and they are more competitive, shall we say, than rural areas. But there are outliers, and the longitudinal schemes are also quite popular. But I would say just preference where you want to work. That would be my advice to you. And obviously, the more that you preference, the more chance you have at being matched to a training scheme.
Yeah, Jess, I agree with that. And if I could add the following, just because a scheme is highly ranked doesn't mean to say it's any more brilliant than anyone else. And I think it's very important. It means it's popular for applicants, but it doesn't mean to say in terms of training quality it is better than some schemes that are not as popular in preferencing.
And there was another question which I'll take, which is: can you defer a DFT offer? So I'll answer this one. So we currently only allow deferrals for statutory reasons. So this means if you are currently pregnant or on adoption leave or paternity leave, or if you have personal ill health, unfortunately, there's no other way you can defer an offer. So say if you do want to travel or something, you would apply again the next year.
So Jess, according to the chat box, that is the end of the questions that I can read. Is there any more?
Caught them. There will be more. They've been coming in as we go through,
Okay,
but as I've been
okay.
answering them, I haven't had a chance to field
Okay.
them. So I think maybe what we'll do is just bear with me. I can pick some more off that I've not looked at. Bear with me. And if not, of course, we'll publish them. We'll aim to answer them all and publish them afterwards. And no, I think we've covered most of the popular ones.
I think we have.
Is it possible to carry out facial aesthetics in your FD year, provided you are qualified for it?
You want me to answer that, do you? Okay. Well, I think it's important to remember that dental foundation training is the contract. It's a full-time contract, and we'd expect people to be working full-time in that contract. And hopefully you'll all agree with me. The foundation training post is a period of massive growth and quite steep growth in terms of developing new knowledge, deepening your competency skills, and being able to learn how to work on patients independently in a general practice setting. So I'm postgraduate dean in London and KSS, and I would not want somebody doing facial aesthetic surgery on patients during their dental foundation year, because I would like to confer that somebody is employed in a full-time dental foundation training contract. I'd really want all of their energies focusing on them getting the absolute best out of their dental foundation training year.
Thank you, Peter. I'll take a question again. I've just seen one that I can answer. Just bear with me whilst it loads. I've just gone off the screen. So somebody's asked, can we, bear with me. I've lost my question now, 1 second. I did spot it. How do you find out about the different programs available to fully understand the options out there? So this is again when we open preferencing for applicants, we provide the scheme templates for every scheme, so you'll be able to determine then how you'd want to practice. And obviously you can also, there was forums mentioned earlier that you can go onto and ask about as well. Bear with me. So I've got another question now. Bear with me 1 moment. This one's for Flo. So in order to maintain skills during gap year, would you accept CPD courses, especially those that had practical courses? Can we do that one, or Peter?
I think Peter might be best to answer
Yeah.
that one.
Yeah, no, thank you. I think the answer is yes, you should try and get on those courses if you can. It would be worth speaking with your local postgraduate dean and the relevant person for workforce courses. But to me, that would seem to be a very sensible thing to do. Practically based courses obviously are very useful for skills and maintaining the skills. And don't forget, you need to be doing other courses in terms of consolidating and maintaining knowledge. Could I just go back quickly to that question, the answer I gave around the facial aesthetics? We do allow certain groups of people to do work in addition to dental foundation training. Classically, doctors who need to do work in relationship to their revalidation, the GMC revalidation, and also pharmacists who also require work requirements in relationship to revalidation. So they tend to be the people that we will approve doing some work, and again it would need to be agreed with the relevant postgraduate dean and clearly not be in any way sort of acting against the requirements of commitment to dental foundation training. I've got one more question here, Jess, about asked about clinical benchmarking. I think Shalene mentioned it during her her presentation. And I think what Shalene's meaning is that obviously you would apply for dental foundation training as you are all going to apply through the NRO. That's the first stage, and then there'll be a separate recruitment locally to the posts are providing academic posts. So the benchmarking is actually this process we're talking about this evening, and then there is an additional process to that that relates to the regions that are offering the academic foundation dentist posts.
So there's a question about which forums. We alluded to some forums earlier about you can speak to trainees, so I'll pass this over to Flo, if you don't mind.
So there's the Deciduous Facebook group, which is for young dentists. That's a really, really good forum to join because it's got newly qualified dentists on it and some final year dental students as well. There's really, really good Q&A questions that sometimes come in there. If you ever have a question, I'd recommend putting it in that. You can start a thread and people definitely answer your questions.
Thank you, Flo. Can I just, I've been asked to clarify something about the application to schemes. So basically, dental foundation trainees are geographically placed together in schemes. But it says I didn't understand what you said about the individual practices. So basically, the NRO will effectively, it's about you preferencing to schemes and being offered schemes. So when you get your final offer, it will be to a scheme within a region. And then when you get that offer, you will then have a separate process locally that is looked after by the local office with that scheme in it, where you will be in some way have the opportunity to match and understand the practices in the scheme so that you can preference the practices in the scheme. And of course, the national ranking will be used as part of that process in terms of the practices available. I hope that makes sense. So you are preferencing to a scheme as part of the national recruitment process, but once you've been offered a post, i.e. a scheme, a placement in that scheme, then the local office will make available to you all of the practices with the information packs related to them, and you make the individual choices to which practice you want to work in.
Thank you, Peter. And I think just time for maybe one more question. So I noticed there was a question about extra time and how you apply for that during the process. So this is for the SJT examination, and if we did the virtual interview process, you can apply then as well. So applying for extra time is called reasonable adjustments, and it will all be outlined in our handbook, but it's done via your oral application. So there's a section when you put your application form through, there's a section where you can apply for it. And as I said, the applicant handbook, which we publish with the vacancy, will have full information about how to apply and what documentation you will need to supply. But of course, for any questions at all that you've got, you can always contact my team via the portal for any guidance or support on anything throughout the application process. Yes, so I'd like I said, if you've got any questions at all, we'll aim to answer all of these questions afterwards, but if you do have any questions after this, feel free to contact the team via the applicant portal, which will be included in the handbook when the vacancy is launched.
Thank you, Jess. I think that brings us to an end of this evening. I'd like to myself personally to thank Helen and Claire in the background for helping facilitate this webinar this evening via the HEE. Also to Jess for joining us from the National Recruitment Office, and Flo and Shalene for joining us in terms of presenting their view of this process to you, because they are a lot nearer to it than clearly I am. So without further ado, I would like to thank all of you for joining us. There will be a YouTube link made available to the Dental Schools Council of this video, and you should also have the opportunity to all be exposed to the Dean's presentation by your local HE offices in the dental schools where you are at present. So I'd like to wish you all a very good evening, and thank you for joining this webinar and making it successful. Thank you very much.